Good morning. Welcome to our special COVID meeting. Today is May 29th. We're going to call the meeting to order, and we'll start by standing for a moment of silence, followed by the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, Commissioner Jenkins could not be here this morning, so I'll be standing in his place, so be patient. And we are going to start this morning with an update from Cleveland Clinic's Rob Lord.
Move approval of the agenda.
Okay. We have a motion for approval of the agenda? Second?
All those in favor?
All in favor, say aye.
Aye.
Opposed? Okay. Motion carries unanimously.
You'll get a lot of help today.
Yeah. Like I said, bear with me. Okay, now we will have a presentation by Cleveland Clinic, Rob Lord.
Thank you, Madam Chairman, Commissioners. Thank you, as always, for the opportunity. I'm pleased to report we see some encouraging signs, and then there's some other signs that suggest we need to continue to be very vigilant. The growth rate, as we calculate it for COVID positive patients over the last 6-day period, was about 2.6%, compared to the week before of 8.3%. And now, obviously, this varies depending on testing and where you're testing and whether or not you're in a hot spot, but that's a good sign. But of course, during that same week period, Martin County has surpassed St. Lucie County's total of infected cases by a good margin, as an example, where St. Lucie County has a significantly higher population than we do here. We far and away, by over 100 cases, I believe, have the largest number of cases on the Treasure Coast. Also, the number of patients hospitalized is increased a good bit in May. And I'm just going to give you some numbers. These are just, you interpret them as you see fit. On April the 29th is the date, so give us a point of reference. The date Governor DeSantis announced that we were going to enter phase one. That was of the recovery. And on the next day, on the 30th, we had 5 patients at Martin North. That went to 8 a week later. 2 weeks later, it was at 15. And today, we're at 16. Now, what you haven't seen pop up on the board are a lot of fatalities. And obviously, we should all be thankful for that. But it's also a testament to, I do want to call it out, we assembled over the last 2 years a remarkable team of critical care physicians that staff our ICUs full-time, and they've done a remarkable job. Our success rate at getting patients off the ventilators is very good, very proud of that team. So we're not seeing fatalities, but every patient that's in that hospital is a very sick patient. You don't get in the hospital unless you're quite sick. And these figures to me remind us that we need to continue to be vigilant, and so it's been repeated, but I see my friends and neighbors not doing some of these things as we should, and I too. Number one is hand hygiene. Again, we can't emphasize that enough. I noticed when this started out, we were all washing our hands 20 times a day, but I think we're falling back into old habits. And we need to that's the number one thing. That's that we can all do. Wash our hands frequently and very well. And then masks, as I said last week, I considered a question of manners and being considerate of others and social distancing. We have reactivated our services. We are providing elective surgeries, always with a focus on safety and for both patients and caregivers. But the feedback I'm getting in the community is a couple of things that are happening here. One, people don't want to come to the hospital because they're afraid that they'll get sick there. And I just want to reassure everybody, we are going to extraordinary lengths to make sure that doesn't happen. I'm not aware of any evidence that that any patient has had any issue out of that. But then the other thing that's really stood out to me this week, and feedback I've received from people in the community that I know, is that they're reluctant to come in because of the fear of loneliness, because of our visitation rules. And I understand that. I think we all can. Particularly now in this crisis, it's already isolating as it is. We have loosened our visitor restrictions for surgery patients so they can have a visitor the day of surgery and the day after surgery. And we're continuing to look at that. Now, if a visitor comes in the hospital, I want them to know they will wear a mask. And if they have a problem with wearing a mask, they're going to be asked to leave. We continue to limit visitors in the outpatient setting. But again, if there's a specific need, if a patient needs assistance, needs accompanying, we will work with that patient. Don't miss out on health care that you need. We're testing every patient prior to surgery. We've configured our waiting rooms and registration areas where people can't come in close contact, and again, continue to clean and disinfect our facilities. We will do whatever it takes to make sure it's a safe place. The drive-through testing continues. We've tested over 3,100 people at the north drive-through alone. If you have a cough, runny nose, sneezing, gastrointestinal illness, combined with a fever, please call 772-419-3360. Our people will take you through a process, and if you fall into that category, you'll receive an appointment to get a test. And of course, we continue to work with our community partners on community testing. I do want to continue to clarify again for the commission. You're aware of the data reporting issue that we had. We were submitting data daily, and it was our understanding that if we received a reply message that said the data had been received, the data had been received, and so that's what we did. We didn't know that for some reason it was not going through to the Department of Health's computer system. And we have our medical record system. I think I mentioned this last week or 2 weeks ago. Is the ultimate, in my view, of medical record systems, run by virtually every large system around the country. So we assumed that it would work right. We shouldn't assume things, and it didn't work right. But the day it became known, as I understand it, our IT team, the state's IT team, got together, fixed that, and that was resolved. So I don't want anybody to doubt the data. As I listen to people in the community, that when we start questioning the data, that's just the wrong direction to go here. This is a problem. We need to address it, and hopefully we have. The last time I was here, I mentioned that our emergency rooms and all emergency rooms across the country have seen dramatic declines in patients presenting that have something other than COVID, and that we think there are deaths happening as a result of that. And we're seeing that slowly change here, and that's good news. But I want to reinforce for the commission and for everybody who watches this that do not avoid that. We have seen some examples from some input that I've received of patients who have come in days post first signs of stroke behaviors or indications, and that's not a good thing. We want to continue to reassure you that we're doing everything possible to ensure that our hospitals and our clinics are safe places for you to come and get your care as you need it. I'll be happy to answer any questions.
Commissioner Smith.
Rob, good morning.
Good morning.
Thank you, as always. Just curious on the computer communication issue. When we were talking internally about it, it kind of reminded me back during Francis and Jean, when we as a state we discovered that not all of our emergency operations management communications could talk to each other and could talk to the federal government, and there were gaps in terms of how everybody could communicate throughout the state and beyond that. And that and a whole list of other things that I wouldn't say failed, but we didn't even begin to think of would be an issue. One of the ones that always amazed me the most was that our fuel distribution system, the connector unions and whatnot for fuel tankers were not the same between the port shipping containers and the local shipping containers. So if a fuel truck was coming out of Fort Lauderdale, you couldn't make a direct delivery to a local
Gas station.
filling station because they weren't the same interconnects. All that got fixed and addressed after Francis and Jean, and I just wonder with this issue, was it more widespread than just us? Were there other hospital systems and the state systems or county systems that couldn't communicate? And I understand you all have fixed our piece of this, but is it a much larger communication discussion that, and if it is, I assume it's going to get fixed, but is it getting fixed?
Well, first, I don't know any specifics about what other problems may or may not have existed. I've candidly kind of had my head down doing what I need to do here and fixing our problems, if you will, sweeping my side of the street clean and we'll let others worry about that. But to your point, interoperability is key, and I think in this age, it's an issue that we see across the board, but it's particularly acute in healthcare. We see it hospital to hospital in our ability to communicate from one record system to another. And now what we're seeing it is in our communications with governmental entities. And in the concern I've had, and with some of the stuff I've read, and so this is not particular expertise on my part here, but while we invest, say in healthcare, tremendously in technology and in being able to take advantage of technology so that when we take your temperature, it automatically enters into a record, or your blood pressure, those sorts of it's been a challenge for governmental entities to follow suit and to keep track. And if you get a decade out in front of a technology, the next thing you know, this won't talk to this because it's just the technology's advanced so much that the older system won't work. It'd be like trying to use a DOS computer today. You can't do it. So an investment in that, and for us to look, hopefully this will let us be more proactive, both for local businesses, the government, everybody else, to look at this and recognize the importance of it. We did a lot of this on the fly as a state and as an industry. And I think we've done a remarkable job doing it on the fly, but it would always be better to do this in a period of calm than it is in a situation like that.
So it's just a thought, and again, I've talked to Taryn and Sarah about it just in conversation, but I had a conversation with Senator Harrell about it and asked her, and it wasn't a yes or no answer, it was more of a, as we move through this and as we start heading out and we all start looking back at what worked and what didn't work and where were their strengths and weaknesses, I wonder if there is a place for legislation or something that requires us both as a state and the industry to make sure that those communication gaps or abilities are kept up with, that for this learning curve like we did back in Francis and Jean with those other issues and other things we dealt with that we didn't have. I just wonder if that's something that ought to be looked at and thought about so that at the next generation of how do we progress as a state, how do we progress as a county, as a community, that if there were, and obviously there were issues, but can we sort of memorialize that discussion and move that forward, both the industry and the state?
I could not agree more. I think that as I see this, the first thing we ought to do is we should be doing it as we go through the process, but certainly as we look back on it when that time comes. What we do in our industry, something that Martin Health did before we were country before country was cool, as the song went. But going back to my early days at the system over 20 years ago, we were doing, every time a mistake was made or a problem came up or a near miss, we would do a root cause analysis, sit down, look at it, see what we could find, what lessons we can learn, and how we can improve things. I think we should do the same thing with this process. I would encourage the governor, at the highest level in the state, to say let's do that. And as we do it, The biggest challenge we seem to run into these days when we do those sorts of things is it becomes an exercise in trying to find who's at fault, who to blame. In our business and what they do in the airline industry, where they have some pretty remarkable safety records, is they stay away from that. It's about systems and processes, and we're going to assume that people want to do the right thing. I can tell you that was true on our end. I can't tell you if it was us or at a state level, I think, but it doesn't matter. We fix the problem and we move on, and we're one team. And if we can do it that way, we can have a constructive process, and at the end of it, come up with great legislation. You mentioned Senator Harrell. My understanding is, or my impression is, watching her through the years, she's championed higher investment in technology at a state level, and so I would expect and be happy if that continued with her. That's my impression of her position all along.
So, Madam Chair, just two more thoughts on that. One would be, as that moves forward, if there's anything we need or should or you want us to address relative to supportive legislation or something as it comes out of it, please let us know. Because I suspect both our Association of Counties at that level, we have our annual conference by video now coming up soon, and I'm sure there will be a lot of this discussion as to what everybody else around the other 66 counties we're seeing. And how do we address that and how do we work with it? But it would be helpful that from your perspective, from the industry's perspective, if you can let us know, we can channel that at least on our side of the equation. And then the other piece of this, I think, and I think it's pertinent to that issue, but it's a much larger picture. And I talked to Ted Astolfi the other day about this, is that that's one thing that maybe we had issues with. But what I'm growing more and more sort of not concerned, wanting to know is what else hasn't worked and what else do we need to know about the community that we don't know that's going on as a result of all of this. And, as we all travel around in our patterns and we're visiting, whether it's businesses, restaurants, whatever we do during our day, and now we're starting to see sort of anecdotally how people are responding, whether they are shopping, whether they are going to restaurants, whether they're not. What is that picture going to look like relative to what's really going on in our community? And I for one, would guess that we don't really know as much as we think we know. And I talked to Ted about this and the idea of maybe getting someone engaged to help us do some really deep research relative to how we are doing as a community. I mean, anecdotally, every one of us could say, oh yeah, I think we're here. Or one of us may say we're here, but past that, do we really understand what has occurred as deep as we should probably understand? And I think as we think about resetting where we are and how do we start looking at the next year and how do we start planning for what may be going on that we don't know, I think it would be helpful probably for us to engage someone to help us do that research and get really much deeper into both business, the hospital industry, people's homes, what is happening that we don't know.
That's you've triggered something I had not thought of before, but if the commission were to, when the time is appropriate, I start with, we're in the middle of the battle, and all battle plans are good until the first shot is fired, I think is and then you adapt and you do what you have to do, and that's what we're doing. I think what the community and you should take comfort in is that you have a team of people that are working with each other, not against each other, to try and address this thing. And I will tell you that I, for one, am very proud of our organization for very much taking that approach. But we're all doing this together. But certainly at the end of it, if the county were to say, let's do that sort of a root cause analysis. In fact, I'll volunteer right now to bring resources to the table that can tell you how to do that. We can lead or help lead something. I'm sure you have that as well. Whatever role you'd like for us to play, we'd like to play. But I think that would be a really helpful exercise. Again, I would strongly encourage you to tee that up. But we're not looking for who to find fault with, but how can we do better? I really like that idea.
Thank you. Thanks, Madam Chair.
Thank you. Commissioner Campy? do you have a comment or question?
I do, thank you. Mr. Lord, thank you very much. I appreciate these updates, and I know everyone that I speak to in the community does as well. This, for many people, I mean, you've been around for a long time, leading Martin Health for a long time, but I think these updates, the televised updates especially, give people in our community an opportunity to see your calm and steady leadership. It's welcome every single day, but it's especially welcome now. And then I was thinking while you were speaking how fortunate we were at the timing. Who would have thought how fortuitous we were as a community of the acquisition that Cleveland Clinic made? Because whether it was last year at this time having hepatitis A outbreak, or now with the COVID-19 issue, although Martin Health Systems was an excellent organization, it was an independent local organization. Didn't have the resources, the breadth of resources that it does now. So I know that when people start getting panicky about, especially in the beginning, how would this affect us as a community? When you heard what was happening in other communities, that their health systems either were being overrun or had the very real potential of being overrun, I didn't feel that way here. And I know a lot of residents didn't feel that way, so I appreciate that very much. A quick question for you on the testing. When you said that Martin County has now had the dubious distinction of surpassing St. Lucie County, which most of us realize is a much larger population county than ours, would you contribute some of that to the really rigorous testing that we've been doing in the last couple of weeks? You said that your organization had tested 3,100 people, but you're not including the pop-ups, correct?
No, sir.
Or
That's
the
just
things-
us.
Correct.
Just
So
our
just
drive-through.
Cleveland Clinic. And maybe, Ms. Christ, I know you're going to give an update for the health department and potentially our own. I think when people hear 3,100, they have to understand that that was your organization's testing.
And that's not even all of ours.
Excuse me?
That's not all of ours. That's just the drive-through. That does not include testing we do on someone who is seen as a patient otherwise, whether it's in our hospital or in a clinic. We've done other tests. I'm just giving you the drive-through
The
totals.
drive-through, so excellent point. But no matter where the individual was tested, by whatever organization, the community health, the health department, private organizations, all of the results are fed in. And so when we hear about our numbers, that is a grand total of all of the different organizations. Is that a correct statement?
Yes, sir.
Okay, so that, I'm wondering, and I've been looking on the state Department of Health website at Indian River County, at St. Lucie County, simply because they're our neighbors. And it looks like our numbers are higher, but it's hard to find accurate grand total amount of individuals tested numbers. So you're in the know better than almost anybody else, at least. Are we testing more here in Martin County than our neighbors?
I have not looked at the total numbers, but my, and to be clear, when I go up to Fort Pierce to talk to the council up there, we're part of that team up there too. So I don't want to get into into anything there. I would say this: I think that first we had a couple of hot spots. I mean, if you look at the by zip code data on the Department of Health website, you see the Indiantown numbers, and then you see the Stewart numbers. So right in those two communities, and we've done an excellent job in Martin County, in my opinion. The we being the collective team, and not us at the center of it. We're a resource when they need us. But of identifying those hotspots, getting in and offering testing, and obviously we need to continue to do that. So there's probably something in that. I would defer to Taryn. I think
when we get to
it's easier.
I'll ask you again.
But it's an excellent point. But it's we shop in the same places. Folks from Indiantown drive in here. Of course, I'm in Stewart all the time. So when you have those clusters, we are also. I think my hospitalization data suggests something. That's just those are just numbers, and it fluctuates. But
Right.
we've more than doubled our inpatient population since we went to the phase 1 of recovery almost a month ago. It's hard to believe it's been that long. So we're just watching that. We can easily manage that patient volume. We're not going to overwhelm the system at that level, but if we hit, you saw those models that had that. If we're at that phase and something that goes like that, then I'll be back here in a couple of weeks saying, wait a second, I've got 40 patients in the hospital, and I'm on my way to 80, and now we're going to, then we'll be having a different conversation. Right now, and I also want to, if I might, just for a second, because you raised a great point, and I just want everybody in the community to appreciate the Cleveland Clinic. And I say this as a resident as well as a guy who works there and was quite involved in that merger. Every night, I give thanks. I'd rather be lucky than good sometimes. I did not envision this as we started down the journey with the merger. But we were able to do things like say, we're going to continue to pay our people, which is a big impact on this community. That's mortgage payments. We're the biggest employer other than governmental by a long shot. And I'd like to think I would have made those same decisions as the president and CEO of Martin Health System. But we're talking tens of millions of dollars that literally we've lost over the last 2.5 months. And all I get is support from my colleagues that say, just we'll take care of the community and we'll keep score later on. We'll figure this out at the end. I don't think I could have done that when I was, I'm afraid that if this goes on for an extended period of time, we'd have been talking about our continued survival. Mm-hmm. And we were a very healthy organization.
Right.
But this is I know this will sound strange because people think, well, the hospital should be busy during this time. But when you do what we did, we had a 235-bed hospital with well under 100 patients in it at the beginning of this when we stopped doing the elective cases, and we were, it's been an amazing experience. But I am so thankful, personally. That I work with such an amazing organization that has taken the approach that it has here. It's taken the same approach in Vero Beach. It's taken the same approach in Port St. Lucie and throughout Northeast Ohio and in Weston. I'm thrilled.
Thank you. Can you also, when you gave us the hospitalization number, you're saying currently in the hospital now, 16 people. You have them all at North. You don't have anybody at South, correct?
That is correct. South. There are no COVID patients being housed at South.
Can you share with us how many people are in the ICU?
It's a handful. I don't have the exact numbers
like
today.
3 or 4, or a handful like 7?
Around, I think right at a handful, around 5, right between those two numbers, I think. Okay. Right now, but again, I give some credit to we're using plasma therapy, we're using the, with just the low oxygen approach. The team of critical care doctors working as a team. They are a group, very collegial, and they've just. We've done. We're very, very proud of that component. We are not seeing a death rate that I've heard about in other places across the country, nothing close to that. And
well, that's fantastic.
That's fantastic, yeah.
What I've been telling people, it's hard. You can, like you said, you can get caught up in the numbers, trying to track the statistics of how many tests and how many and who were still sick and who tested positive or who was positive without symptoms. For me, what I've been telling folks, the numbers that I focus my attention on, and you've been very helpful, how many people are in the hospital, how many people are in the ICU, how many people have passed away. Those numbers are fixed numbers. They're in your hospital, they're in your ICU, and the number of fatalities, tragically, is a defined number. It's when you start talking about hot spots and here and there and whose communities have more hot spots and what about nursing homes. And so those are my 3 indicators, and I'm pleased as much as we can be under the current set of circumstances that this is where we are. That's what I use as my barometer. So I thank you, because if people go from the ICU back to the hospital and back home, then your team has done a fantastic job, and that's all we can ask for, so thank you.
Now, something for us to be aware of. Now, many of these patients who recover have consequences of having had the condition that may last a lifetime. So they live through the event. But this is an illness that can leave lungs damaged, and I mean, there's other aspects to that. So, and we need to be mindful of that and consider the people who have that and take that into account. But thank you very much.
Well, sadly, like many other ailments, sometimes you can have an ailment and you can quote unquote recover, but you'll have a chronic illness for the rest of your life. This is going to be one of those illnesses.
Yes, sir.
Thank you very much. Thank you, Madam Chair.
Thank you, Mr. Lord. We appreciate your commitment of being here each and every week.
Thank you so much. Have a great day.
Okay, now Department of Health could not be here this morning. They're attending another meeting. Tara and Krista is going to give us their update.
Yes, ma'am. So what I got from Carol Ann was that we've got, in the state of Florida, there's currently 53,285 positive cases. 557 of those are here in Martin County. And to Commissioner Campy's point, going into this, the Department of Health was tasked by the governor to get at least 2% of their population. And right now, we've exceeded that. We're almost at 5%. It's 4.72% total tested. Of those that were almost 7,500 tested, so 6,912 are negative, and then the 557 are positive. So the Department of Health continues their contact tracing. The nurses that were sent down by the state have been obligated to stay for another couple weeks to do this contact tracing. They were individuals that had the necessary dialects to be able to effectively converse with the individuals that were being contact traced. So they continue to have their daily calls, and the governor now has asked the Department of Health to redirect their focus, if you will, and look at the pediatric issue, because we know that the pediatrics, there are positive cases in the state relative to how, whether it's COVID-19 or what's happening to the pediatric population, and then also to do the long care facilities testing, get all of those tested, as well as the short-term care facilities. As you know, they did all the assisted living facilities. They got that underway. So that's where they're focusing their attention right now. Cleveland Clinic, Martin Health will continue to do testing in their North facility. And also we know that out in Indiantown, particularly the Florida Communities Health Center will continue to do testing as well. There is a focus on education in Indiantown, trying to hit the radio stations that we know the individuals listen to, as well as if there's any TV stations. Senator Harrell, as we had mentioned earlier, is very involved in this as well. So the Department of Health maintains their local call center for any questions that you might have. It's Monday through Friday, 8 to 5. The number is 772-221-4000, option number 9. And then they have their website also with floridahealthcovid.gov. And so out in Indiantown, when we have the 557 positive cases, 207 of those currently are in Indiantown. So that's almost a 37% positivity rate in that one area. So we will continue to focus our efforts out there. We had masks. I know Chief is here to talk about emergency management, but we got masks delivered out there. We got those to the manager. They're working with the local churches to get those distributed, and they're trying to get everybody educated, because that's really a key, and making sure that those folks, because we're finding a lot of them are asymptomatic. And so, again, it's that education. So that's it for the health department.
Any question?
Do you have any questions?
The urgent cares and the private practitioners
Yes, ma'am.
fall as a reporting mechanism. Do they report to the Department of Health? What's their reporting mechanism?
As I understand it, they're also supposed to put their reports into the state. And we wait, we try to get our information. If you go on the state website, they have it by zip code. We know that we've had some instances where the zip code may have been attributed to East Stewart when it were really Indiantown, or it was really Salerno, or it was different areas. So we're continuing to work, but it should all be reported to the
So
state.
they do submit their total number of tests, positives and negatives,
As I understand
to
it,
the
yes,
Department of Health.
to the state.
Does anybody else have any questions? Thank you. Okay, now we're going to go to an update, emergency management by Fire Rescue Chief Bill Schobel.
Good morning, Commissioners. Bill Schobel, your Fire Rescue Chief for the record. And I'm filling in for Michelle Jones, your Emergency Management Director today. She has a very well-deserved day off. Unfortunately, the pandemic, or 911 calls for that matter, don't take nights, weekends, any time off. So she's been working very diligently to keep everybody informed and safe. Which leads me, I'd like to make an introduction. We have a public information officer, new public information officer for fire rescue, Bethany Alex. She comes to us from a very large organization in Central Florida, Orange County Fire Rescue, where she was public information officer and a data analyst. And I would like to share, as we always challenge ourselves to raise the level of service to our community, part of that is analyzing data and keeping the public informed and educated, hoping to prevent a 911 call from ever happening. But with that, I'd like to introduce Bethany, and if you have any questions for her.
Any questions? Commissioner Camping?
Did I hear your last name was Alex?
Yes, sir.
Miss Alex, thank you very much and welcome. You could not have come at a more, for us, a great time. For you, we'd have to, you're definitely jumping into the deep end of the pool. I think, and what the board has always pushed for, and we have a great organization on our side of the building, which is our public information folks, but adding a new member to the team is great. Can you give us, what I like to do with new employees, can you give us a little bit of your background, where you came from and how you ended up here?
Absolutely. Well, I grew up in Palm Beach County. I moved to Gainesville to get my undergrad in political science.
Where'd you go?
Go Gators.
The University of Florida. Go
Go
Gators.
Gators.
I found my love for the public sector there, so I wanted to continue my education, get a little bit more knowledge and experience. So I moved to Orlando to get my Master's of Public Administration.
Where'd you go?
UCF, the University
Go
of
Knights. I have a knight and a gator, so you're perfect so far.
There must have been some kind of a hint on
If you say something about your family being in the Navy, then, you know.
I promise this wasn't a setup. From that point, I found myself doing a lot of service learning projects in the public safety sector. So I wanted to get involved in the fire rescue field, where I found myself as a public information officer with Orange County Fire Rescue. I did a lot of the public records, more internal organizational communication, and then I transferred over to the fire planning and research side of it, which is completely eye-opening, and no, I did not plan fires, as deceiving as that title was. So I got some of the operational knowledge there. I saw this opportunity with Martin County, and it was no questions asked where I wanted to be. Closer to home, obviously, but this is where my heart is, in the state of Florida, and with the public safety sector. So it was an opportunity I could not turn down, and I am absolutely blessed and lucky to have the position that I do and be able to communicate with the community and find such passion within Martin County. And it's an exciting time, definitely.
Well, you're joining an excellent organization, not just Fire Rescue, but Martin County government in general. So we're thrilled to have you. We look forward to, you're the first one. You're the inaugural PIO for Fire Rescue.
Yes,
so
sir.
we look forward to all of your wonderful work during this crisis and then obviously for years to come afterwards. Welcome.
Thank you, sir.
And if Commissioner Jenkins was here, he would let you know that she's located herself in Hope Sound, so.
I wasn't even going to go there. I figured I got UCF and the Gators. But, you know, we have a lot of beautiful homes in Palm City, District 5. Just letting you know.
Thank you for being here.
Thank you.
All righty, next up, just an update. Again, working hand in hand with the Sheriff's Office so much as we do, Fire Rescue joined the team for rapid action teams on the water this weekend. Unfortunately, the weather wasn't the best, but you did have public safety out there in the water, assuring that everybody was safe, with emergency medical services out there, fire suppression, and also law enforcement working together on the same boats. Our crews in fire rescue continue to take additional measures to decontaminate the ambulances after each transport that we do. And we also wear masks in the stations when necessary, and also out in public when necessary, of course being examples to follow in the community. On the emergency management front, they've received approximately 5,000 pounds of rice, beans, and flour, and are providing this to House of Hope. Rob, I think, yep, right back there, and who is assisting in distribution to the Indiantown community and pantries. We are coordinating and distributing supplies to support county departments and to the county's reopening initiatives. The Community Information Center remains open Monday through Friday, 8 to 5, 772-287-1652. Again, 287-1652. That's all. Do you have any questions?
Great. Anybody have any questions? Thank you.
All right. Thank you.
Thank you. Next, we're going to go to United Way, Carol Howard Dietz.
Good morning, everyone. How are you? It's Friday. Yay. I'm here to present. Thank you for giving me this opportunity to present on behalf of nonprofits in Martin County. As we continue to move forward in reopening, our agencies are really gearing up to reopen and following the CDC guidelines. In addition, many thrift stores are opening, so if people have donated items, I know Salvation Army, House of Hope, and any others that are out there would welcome those. As I reported a few weeks ago, one of the challenges that we're seeing this summer is childcare and summer camps for our community. And I know we're all aware of it, but what I'd like to make a plea to any local business or county or anyone that has space to find the space for our nonprofits like the Boys and Girls Club and the YMCA. Because of CDC guidelines, they can't have kids as close as they used to, and it's really putting a strain on our system. And it's not only just affecting our low-income individuals, it's affecting any two-parent household that needs these services. So if we can work together and find solutions, that would be amazing and really appreciated, because we need this for our families to rebuild and our economy to rebuild coming up, and not to have moms or dads make the choice of going to work or staying home with their children. So I think there's others here that will also be talking about that. But in terms of food, we continue to monitor the demands on our community and our system of providers. We're working with a lot of different providers. I can only report on the providers that are working with the EOC and the team that's there. But we do know that breakfast and lunch will continue through the school district all summer long. We also know that the Treasure Coast Food Bank will have sites for families to pick up food all summer long. Also, we're working with community members to make sure that there's food in different areas of need, and House of Hope has been a great help. So Rob, I'm giving you a shout out. Thank you for all that you're doing. As we see our community going back to work, we're hoping that the demand on the food system will be less, and that we can continue to monitor this with our community resource task force. Just a quick update on the mask, because as you can see, I have a different one to match outfits, just in case anyone else needs that. We have that for you. There's been over 6,334 masks that have been sewn from our community of sewers, so we want to extend a big thank you out to them. And they're still continuing to sew, so if people need them, we actually have a supply on hand. You can call our office, and we will get them out to seniors or anyone that needs them. They can pick them up at our office. A little update on the funding consortium. That is the 12 funders that have come together, government, nonprofit, and also corporations. There's been over 24 awards given to agencies in our community, totaling $810,000 to make sure that our agencies are strong and can serve our community. In addition, the United Way's COVID Fund has provided over 60 families resources so they can stay in their home and stay solvent, and that is a total of $64,514 that has gone out into the community. And again, our partners at House of Hope and Salvation Army have done that work for us. We continue to track the volunteers that are COVID-related that are going out into the community. And to date, as of the end of April, it is saved our community $155,000, which also will help us as the county as we go back for reimbursement. And it's only going to continue to grow, so that's an amazing thing. And again, if there's any seniors out there that need help, shut-ins that need help, we do have volunteers that have actually gone out and are doing grocery shopping and all kinds of things. We're doing wellness calls and all of that. So if there's any seniors out there that need help, they can call our office at 772-283-4800, or they can call 211 for any other kind of assistance. Anybody have any questions?
Commissioner Campy.
Very briefly, you said about folks that needed volunteer help. What about folks that want to volunteer, especially young people?
Actually, we're being inundated with that right now. We have a volunteer center at United Way. They can call our office. We are working to make sure that we can deploy them to safe environments where they can work and where the agency also can help be a part of it. I do know Meals on Wheels really needs help, so if people have cars and can drive, that's an amazing opportunity for people to deliver meals, because a lot of our volunteers that we're helping have gone back to work. So if there's any seniors or college students that are looking for an opportunity, that would be amazing.
Are you the clearinghouse for all organizations, or should people reach out individually to different organizations that they believe in?
We can be, because we have a volunteer center, and agencies will let us know what volunteer opportunities are out there, so we can be that clearinghouse. Yes, absolutely.
Thank you very much.
Yep.
Thank you, Carol.
Thank you.
Okay, we're now going to go to a business and economic update, starting with Business Development Board Director Joan Goodrich.
Good morning, Madam Chair, Commissioners, Administrators, and members of the community. As you said, I'm Joan Goodrich from your Business Development Board, here to provide an update and briefing on our recent Survive, Revive, Thrive, Response, and Recovery Plan. But before I highlight some of those aspects of the plan, which continues to be fluid because this pandemic is fluid, I'd like to thank your team, led by Taryn and George, all of our economic partners, which comprise of the Martin County Biz team. There's actually 30 of us around the table that meet with us regularly to provide great insight, feedback, collaboration, and responses when we're trying to help our businesses and residents. On yesterday's call, we got a little dose of reality as to our numbers on the economic side of things, our numbers coming from CareerSource, and of course our Department of Economic Opportunity. And while we expected these numbers, it's still sobering. So right now our unemployment rate is 11.9%. Our numbers are 8,212 of our Martin Countyans find themselves out of work through no fault of their own. And of course, many of our local small business owners who are stressed to the brink and are on the edge, who have had to make some of these heart-wrenching decisions to let some of their best people go. But they're doing their best to stay in business, reset, rebuild, and certainly reopen. So it's with those families and faces and business owners in mind that we have come to love, that are at the heart of this plan. And so what we're trying to do with the plan, you know, it's real simple, and of course y'all have been talking about this. We're trying to save as many businesses and local jobs as we can. With our partners, we're trying to promote local hiring and finding locals jobs and their next steps in their careers as quickly as possible. And that includes with our education partners. You know, just this week, IRSC announced some of their great next steps in upskilling, some of their new certificate programs that they're offering. We're continuing to build, though, at the same time, our entrepreneurial ecosystem, because we know most of our job creation actually comes from our new businesses and startups. So we continue to try to fill in that ecosystem, those gaps, increase our support, training, and resources to our small businesses and entrepreneurs. We believe there's great new work that we can do to boost and promote, encourage local funding for business innovation, reengineering, and resiliency, and we want to spend some time with you and our economic partners in doing that work. And last but not least, advocating for more of that local buying by our institutions, by our neighbors, by our businesses with each other, because the more dollars, local dollars we can have circulating in the economy, that will certainly help us with our recovery and rebounding. And of course, Taryn, you just talked about that on the daily video yesterday with the great reminder to our community of what the county is doing with its capital improvement projects underway, what you have in the pipeline. Again, we've got to do better in encouraging our local businesses to step up, take advantage of these opportunities, so we'll be working with you on that. So again, thank you for that continued investment. As far as the plan is, we broke it into 3 areas. We tried to align it with the governor's Safe, Smart, Step-by-Step plan. The survive period is what we're currently in, and we tried to do that communications, those touch points, trying to get our hands around what the need of our community was. Revive is the second area of the plan, and this is what we anticipate entering. We did put some dates in the plan, June 1st for Revive, June 1st through December 1st for the next 6 months, but of course that was just a time period for us to kind of get some things in order, and that's also tied to the governor's plan. And then lastly is our Thrive period as we come out of our Revive work, as we look forward to new opportunities for our community. Again, I can go into details. I know you've got this plan in front of you, but a couple of the things that you asked us to do, and certainly in the Survive area, or the Revive area, we will, you challenged us and our partners in the community to tell that story, to tell the story of the businesses reopening, the fact that they are following CDC guidelines, taking those next steps forward. So we just love what the city of Stuart is doing with their new visual campaign called We're Ready. So we want to also deploy that throughout the rest of the county, and we invite each of you to help us identify some of those businesses, join us on camera, tell that story to our community. Just as we were talking earlier about the need of personal protection equipment for our frontliners, our first responders, our healthcare workers, we need the same for our employees and workers. So, we're putting together some supplier lists, and we'll turn to some of our other partners that have already identified this, so we can push that out. As Carol and others have talked about, and you have talked about with the child care system, we want to do our part there. So we want to figure out what our capacity is right now on the private sector side of our child care system. And I'll just talk in a moment with some of the data that we're seeing from other sources that is scary. We want to also turn to our businesses, our professional service firms, and see if they'll donate, talking about if they'll volunteer some of their time to work with other business owners as they're looking to rebuild, reset, rethink their businesses. So we've got to give us 5 hours this month to help another business owner. So we've got that in our plan. And I think, again, we've got an opportunity with the voter education campaign that we'll be working together on as we prepare our voters to consider the reauthorization of the economic development tax exemption tool. So as we look at our efforts and toolbox and try to match that with the needs of our economy this time, we see some synergy there. And access to capital. We've got to figure that out with our partners throughout the community. So I've started to talk with, some of our banking finance leaders, some of our philanthropic leaders as to, again, can we build an innovation fund? What can we do? Because that gut punch that we took with, the news of our neighbors to the south of a $60 million business relief fund, That's really put, we don't want to put that message in the minds of our businesses that we don't care, because we do, and we're here to help. So we've got to figure out that access to capital, because again, our economy is small business. More than 95% of our businesses employ less than 20, and 20% of those employ one or none. So we're teeny tiny, and we've got to solve what has always been an issue for small businesses to gain access to that working capital. So again, I want to emphasize this is a fluid plan. This is just some of our thinking at this moment in time. We encourage ideas from you all. Your team has been amazing in giving us some sense of the needs that you all are seeing. Our economic partners, again, we thank them for all of that. So we anticipate this will all be fluid. And before I turn to the briefing over to my partner, Ted Astolfi at the Economic Council, I do just want to weigh in a little bit on the child care thing. It is a crucial part of our economic infrastructure. I know normally we don't, in my circles of economic development, it's not something that we had normally talked about in even good times or even bad times. But certainly this particular time, it's critical that we figure it out. In a survey and just a data point, because I'm a data nerd, in a survey of child care centers and homes conducted by the National Association for the Education of Young Children, they found that just 27% of our providers could survive a safer at home closure of 1 month. We know our safer at home was longer than that. And without government support, they were already under-resourced. They were already operating on thin profit margins. So we don't know if we'll get them back. But that's just on the federal level. And we do know that it was some of that inspiring data that Congress did put in their relief bill, $3.5 billion for the Child Care Development Block Grant to help states and communities support the temporary aid to providers to support child care for children of our essential workers and our frontliners. Yet support for the private providers, our private providers had to compete with every other industry and business as they lined up for economic injury loans from the SBA or try to enter into the payroll protection plan. And because of their tininess, we're just hearing anecdotally they weren't that successful. And certainly several of our Federal Reserves across the country have acknowledged sectors of the community, really must come together and figure this out, because as Carol said and as you've said, until we do, our rebound will be not as quick as it is. So what are we doing at the BDB? We are going to do, I've had some conversations with our nonprofit leaders, David Heaton at the Children's Service Council. So we're going to do some of that data gathering on the private sector part of our child care providers, seeing who's open, seeing who has capacity at this point, what their plans are moving forward, what they need. And so as soon as we have more of that information, we'll go ahead and bring that back to the tables that are working on helping to solve this for our community, so we can see what next steps we need to take. And then just one more thank you to each of you in your offices for connecting us to businesses that are calling you or residents that are calling you, looking for jobs and those connections. We're making those we're accelerating those calls to our economic partners so that those can be solved. So please keep sending those folks to the Martin County Biz Hotline. We're at 772-221-1380. So the Martin County Biz team can serve each of these business owners and residents individually. So that concludes my briefing this morning. Thank you so very much for the invitation to come back and provide this update, and I'll turn the microphone over to my partner, Ted.
Ted, you have 15 seconds.
Left remaining.
Great. Thanks.
Commissioner Canby, I appreciate that. In those 15 seconds, before I get started, I've heard a couple of references of Dave Heaton and the Children's Service Council Day, and I thought maybe we could have him just come up for a minute and give us a little update on that before I do my thing. If that's all right with you all?
Sure.
Just a suggestion. Thanks.
Thank you, Ted. Good morning, Dave Heaton from the Children's Services Council. Madam Chair, if I could give you an update about what we're doing in the summer camp and after-school space and childcare space. Because Joan mentioned it, of course, Carol mentioned it. It's a big issue, a critical factor when we talk about return to work. And critical in summer when we have to socially distance, configure in smaller groups. To that point, space has become a very big challenge for this community. For those centers that are typically operating in the summer, their capacities have, in many cases, been cut in half. The council has had a very robust conversation on this subject. The other element of this conversation has been the impact of virtual school and the experience that many of our children who are from our challenge communities have had with virtual school has been in some cases less than satisfactory. So there's a responsibility, I believe, and the Children's Services Council believes, to provide some academic support program and system in our summer camps. We've done that for several years, but this year it becomes particularly important to offset summer slide and to help those kids who did not have a productive experience for the last 8 weeks of school to kind of reintegrate, reconnect, and do that in a way that's not virtual, but in person. So the council yesterday made some decisions that were helpful. First of all, the realization was certainly apparent that many of our programs did not have adequate space to socially distance and configure in groups of 10 and then serve the number of kids and families who are out there asking for that service. So not only do we have to reassure parents that it's safe to come back to those group configurations, not only do we have to correspond with the governor's announcement last Friday to open sports programs, open summer camps without restrictions, he did give some latitude to local governments and communities to make some local decisions in that realm. So the council very graciously agreed to put out an application 2 weeks ago and ask all of our portfolio of out-of-school providers to look beyond their locations, beyond their restrictive locations, and see if there were other entities in the community that could assist them to expand their opportunities to serve more kids. Several have come back very quickly, and those applications were considered yesterday. The Boys and Girls Club, the YMCA, and the Banner Lake community down in Hope Sound were all able to locate additional facilities beyond their current facilities to expand their numbers, and the council made several decisions yesterday to grant funding to those 3 entities. Now, that is not to say this problem is completely solved. There are huge opportunities within the school district. School districts has chosen at this point to stay closed for the duration of the summer. That affects 850 kids that are typically served in out-of-school care in school district programs. So the City of Stewart began operating May 18th with a very reduced number. I learned just 2 seconds ago on the phone that they have made some arrangements with St. Mary's Church and with the shuffleboard courts to expand their programming beyond that number. The Boys and Girls Club is looking at a configuration of portables that have been vacated when the school district staff moved from those portables to their new location on US 1. The YMCA has secured the fairgrounds and are able to expand into the fairgrounds. So those are programs that are clearly looking outside of their space. We need to encourage more of that. We need to look at all of our resources in this community. We're blessed in many ways. The county has lots of resources. The county's plans for reopening and providing out-of-school and summer care first are addressing their staff and you all know this, your staff and your staff are important to come back to work as well. You've got a lot of facilities that we need to maybe look at as options for our summer camps. So that's really what I want to say, and I appreciate so much your support, the council's support, to kind of think beyond our normal thought processes and get this need addressed, because it's extremely important for our kids. Got a lot of kids who won't have anything if we don't get at least some opportunity outside of our normal configuration. So thank you. Thanks, Ted.
David.
Thank you, David. Excuse me. I wanted to make sure we got that out there because it's an important aspect. It's going to be a recurring theme, and I'm going to talk about it more towards the end of my comments here. First of all, let me introduce myself. I'm Ted Astolfi. I'm the CEO of the Economic Council of Martin County. We just had a great presentation by our Economic Development Agency, the Business Development Board, with Joan. And I'm here to hopefully not make as much of a presentation as kind of have a conversation with you all and make some policy suggestions and requests of you as the Board of County Commissioners today. And before I get into that, I just want to say thank you for your support of the business community, your quick and positive action when I came up and asked about the outside dining and tent facilities was fantastic, and I really appreciate that. I want to give a shout out to Sheriff Snyder, Chief Sobel, Doug Lane for their positive attitude about working with our business community and not being harsh and overreactive to the business community, actually helping them to get open safely. So we really appreciate that. And then your staff throughout your organization has been helpful, and I'll just throw out a few names: Larry Massing, Paul Schilling, Narissa, I won't say her last name, from the TDC, Susan Corris, George, just some of the people on the front line that are out there working with us on a regular basis, communicating with us, coming up with ideas. This idea of waiving the fire inspection fees for businesses for a year came out of your staff. That was a really proactive, pro-business thing for you all to do, and you came up with that. So from the business community standpoint, I want to say thank you for supporting the business community. I do want to bring up one issue. It's not a big issue, but I think it's helpful to make a statement to our community. Taryn's been out there doing her daily updates, and I appreciate that. There was one that went out with a statement that talked about, has a statement that reads, as we move into the recovery phase, protecting the health and safety of our employees, residents, and visitors remains the primary goal. I'd like to add the word, ask you to add the word business and economy into that, to put it into that goal statement that your primary goal includes businesses in the economy. The county's been taking thoughtful action to keep our residents safe while you continue to safely and step-by-step open up your facilities to the public. But I think that, what happens in this community particularly is over the years, we've kind of taken business for granted. It's not always been easy to open a business here in Martin County. And it made me think of a song of When I'm Gone. I'm more the pop culture guy, not the country guy like Rob Lord. But I think it was in that movie, Pitch Perfect, right?
Where's the cup? Did you bring the cup?
I didn't bring the cup. I can't do the cup song. And I'm not going to sing it. But there's a line in there that says,
come on, Ted.
You're going to miss me when I'm gone. Okay? And the point there is, I think that, and Commissioner Smith was saying this early on about when you're in Publix, thank those people for being open and being there to serve you. A lot of these businesses were closed, or we weren't going out to them because of the situation. And I want to encourage all of us in the community and our citizens and residents to take a moment when you go back out, when you feel safe and you do go back out to those businesses, whether it's your favorite restaurant, that little local boutique that has that perfect gift, your hair salon, which I need to get to, or any other business you go to just stop and take a moment and thank that business person and that business for being there, and let them know that you did miss them when they were gone, and that you do appreciate them being in our community, because all these businesses that we kind of just take for granted as always being there for us to go out and do things really do make up our quality of life and help our economy thrive. And so I just wanted to get that out there. Moving on, I want to talk a little bit. We hear a lot about statistics. Commissioner Campbell talks statistics. Jones is a statistics nerd, or data nerd, self-admittedly. And those are important things, and numbers are important. And I just want to talk about one. I touched base with Brian Bauer from Career Source. He sent me a great spreadsheet on unemployment. And I just want to get us to wrap our head around unemployment for a second, because in April of this year, as Joan said, the unemployment rate was 11.9%, okay? A year ago, it was 2.9%. So that's the growth, just in percentage, right? But while that's extreme and of great concern, you know, that was 2,100 people last year. Now it's over 8,000. And that's pretty staggering to think of 8,000 of your neighbors and friends and coworkers out of work. But to put it in perspective, you know, these are the people that are going through our food lines at the fairgrounds that House of Hope and United Way and the Community Foundation are helping, right? But the combined student body of Martin County High School, Jensen Beach High School, and South Fork High School is under 6,000, right? You can add in another 2,000 middle school students. It would be Hidden Oaks and David Anderson to even get to that 8,000. So imagine a parent of each of those 8,000 students being out of work. And what that does to that family, to the stress that goes on at that household, to the need to feed those families. So it isn't just those 8,000 individuals, it's 8,000 families that are in need and are in crisis right now. And you know, we want to get them back to work. We want them to get back to work safely. They need to get that income going again, and our businesses need those people back. And that leads me back into this whole discussion of childcare, okay? And it's childcare, it's daycare, it's summer camps. The county's opened up summer camps. You've opened up your athletic facilities and parks and rec to the public. So at the same time, we're trying to fight an academic slide that's taken place, as Dave Heaton was talking about. Even during the last 8 weeks of school that was closed because of distance learning, it's a different way of learning. Not every family has that parental support to help make that distance learning meaningful. So one of the issues we have, and I think one of the real keys, is the facilities. When we have to work with, when these organizations have to work at a 9-to-1 ratio, no more than 10 people in a room, facilities become the critical issue. And I think Angela may be talking about this later. It's not as much the staffing level. I think they're working very hard on the money piece. Children's Services Council is helping the funding on that. There's opportunities there. But the critical issue is physical space. To accommodate that 9-to-1 ratio, we need more smaller spaces throughout the community. We believe very, very firmly that the most cost-effective and efficient solution is the use of existing taxpayer facilities. And specifically what I'm talking about are the Martin County schools. And what's happened is, from the state down, Department of Education, Governor's Office came down and told the school superintendents across the state, close your schools. Right? This was several months ago, during the school year. And I understand closing schools during the school year, closing educational programming, where you've got 30-to-1 ratios in a classroom, you've got hundreds and hundreds of kids in the hallways and in the cafeteria and so on. I get that. And I know the teachers union was very concerned about that. But it's been interpreted as close the doors on all facilities for all purposes. And I truly believe that we need to open up those school facilities so we can put 9-to-1 ratios in classrooms instead of going out and trying to find other temporary space. That they can come in and clean those facilities overnight. They've got custodial staff, but the space is there. The taxpayers own that space. We need to let our students back in. At the school board meeting this week, students and parents stood up and pleaded for the school district to open up their gyms in their athletic facilities so their seniors could continue to do physical training for their sports teams, because they want to get into college and they're depending on that physical training to continue. And if we can open up private gyms and we can open up public recreational facilities, I don't see why we can't open up gyms at schools and recreational facilities at schools and classrooms for these other service providers. I'm not asking teachers to come back. I'm not asking for that 30-to-1 ratio. I'm asking for multiple classrooms. I know you're not a school board, but I want to bring this up because what I heard also at the school board on Tuesday night was they said, we need a request from a federal, state, or local government to open our facilities. So I'm here today to ask you to write a request to the school district on behalf of the county. I'm putting this on you, Sarah, sorry, because I can't word it right, but I'm going to read it the way I think it needs to go. You know, we were talking about use of the portables that they're about to tear down at, I think it was, Angela, correct me if I'm wrong, $18,000 a month, plus $70,000 at the end to tear them down, which is already in the school district budget to tear them down. So I don't understand that. So there's a sense of urgency for the public, for the portables, but if we don't have to worry about the portable units if we can open up the school sites. So we need to ask the school district, hopefully today, if we can write and deliver this, and I don't know if Sarah can do that, but I'm going to push you, Sarah. Come on, you can do it.
It's our anniversary.
To deliver that request to the school district today to open their facilities for summer activities like including outside sports facilities, gyms, classrooms, and other facilities for youth programs and summer camps and childcare, and maybe other programs that we haven't even identified yet. And also, and this is another critical point, also request her to open those facilities as hurricane shelters. June 1st is Monday. Hurricane season's here, okay? And our superintendent said at a chamber meeting that she was not going to open for the hurricane shelters.
She can't, correct me if I'm wrong, but we already have an agreement with her for that.
We have an agreement and Florida law requires it.
Okay, well, she's making that statement. So it's disconcerting to the community when they hear statements like that. So thank you for putting that on the record, Sarah. Can you say it again?
The schools will be used for hurricane shelters. We have an interlocal agreement. We also have a Florida statute to back us up on that.
And that's because that's a disaster, right? That's for disaster recovery? Or
Yes. Well,
protection of
it's for safe sheltering.
safe shelter.
Well, to go even further, when schools are built, the statutes that I understand it are stated in such a way that the schools are to be built in a way so that they can be then used as shelters.
Yes.
Yeah, in case of a disaster.
Correct.
Correct.
Right?
Mr.
Because
Astolfi,
hurricanes are basically a disaster.
Commissioner
right?
Campy has a question for you.
More of a comment than a question. I appreciate your passion for this, but wheels are starting to fall off the meeting, so let me offer something to you. I believe, and I have had a conversation with a couple of school board members, I think that our school board and superintendent are leaders in student education and safety. So I'm not nervous to make a motion that would request our staff to get with the school district staff to collaborate as we have, like you were mentioning about hurricane utilization of school facilities, to have that same mindset for summer programs. I think that we have, like you mentioned, have looked into all of our resources, location resources on where we can do that. But the logical step would be to utilize some of those school spaces. I would speak to last year when Ms. Krista and I worked hand in hand with the school district on creating a pet-friendly shelter. There was a lot of concern on how would that be able to happen. I think we're reminiscent of that concern on how do we, access these school facilities? How does the district keep their mandate to protect the health of their students and their employees? But where there's a will, there's a way. So I feel completely confident that Ms. Gaylord and the school board will be able to collaborate with us to address that issue. Because like the speakers have said, and I had it in my comments, summer camps speak back to, you're looking at it from an economic point of view, which you're supposed to, and same with Ms. Goodridge. But as a parent, and my kids have gotten older, but remembering when they were younger, there is an emotional and mental health component for our young people that cannot be ignored. I've seen it with my friends who have younger children. I've seen it with my own. This is a very, very difficult time for grown-ups. It is compounded for children. And the question of, hey, I need to go to work today, but where are my kids going to be, is an unfair burden that we should work very hard to stop having to be one of the issues. So I didn't watch the school board meeting, but knowing the people that are involved in their leadership, I feel comfortable. So, Madam Chair, I would make a motion that that we request our staff to collaborate with the school district staff to create opportunities to utilize those facilities creatively, collaboratively. We as a community, as the County Commission side, and even what Mr. Heaton said about the Children's Services Council. If there's concern about sanitization or cleaning up after the fact, or how would these things be collaborated, we have great minds. We have creative, collaborative minds. Let's get that done immediately. Thank you.
Okay, we have a motion on the floor by Commissioner Campy. Commissioner Smith, do you have a comment?
Yeah, it's an add-on to that, Ed. I think if I listened to Ted correctly, and I, for the life of me, I'm not sure I understand why, but if that was the comment, if that was the direction, I think it ought to be a formal request from the county commission to both the superintendent and the school board itself, not just a staff directive to go talk to other staff, that we put a formal request in to the school board to open their facilities for the summertime activities.
I apologize if that wasn't clear. I absolutely meant that.
And I would follow that, Sarah or Taryn, whoever is going to put all this together, that we do it also in such a way that we copy the governor's office and we copy our legislative delegation, but the legislature as a whole. I'm imagining that this isn't the only sort of situation around the state where this has popped up.
Everywhere.
And I would think at the state level, at the governor's level, that there would be a significant level of energy and attention, especially that school has ended this week, directed towards that whole issue, that I can't believe this isn't actually coming down from the state to all school districts throughout the state, that they are to work with their nonprofits, their local government, whoever's involved in the process, their Children's Services Council, if they have one. Not everyone has one, we do, but not everybody, to figure this out, but to mandate that there is no exception for not participating. So however that gets worded, I think that the direct ask, if that's what Ted is asking for, should be the direct ask. But secondarily to that, I think there needs to be an accompanying communication to the governor's office in the state.
And if I may, perhaps the Commissioner of Education, Department of Education.
Department of Education, fine. I don't think they should be left out of the ask, so that there are if other counties are asking the same thing,
Correct.
that message may be further received at the state level. That.
So are you, just to clarify, so you want us to do a separate request at the state level, or just copy them on our letter?
I think a copy with probably an additional letter that attaches to the copy that is directed directly to the state. The ask goes directly to the school board and superintendent. The secondary part of that is by the way, to the state, this is something of statewide significance and of issue, and it would be significantly, I think, important to all 67 counties, 16 cities, that we collaborate to the greatest extent possible, as we would do in any other emergency. And you brought up, and you all talked about the hurricane shelter part of this. It's the same thing. It doesn't, different issue, but same kind of. So I would second your motion, Commissioner Campy.
Okay, we have a motion on the floor by Commissioner Campy, seconded by Commissioner Smith. All those in favor say aye.
Aye.
Opposed? Motion carries unanimously.
Thank you, because with the end of school, that's an important issue. I just have one more.
I'm sorry, the motion carries 4-0.
Jenkins not here. Just one other thing I wanted to touch on, and it follows up on Commissioner Smith's comments earlier about getting some.
Have that man removed?
Yeah.
Thanks, George.
That was your great segue out, George.
I have to pull my mask back on.
How to leave a meeting when it seems obvious that you shouldn't?
I'll tell you.
There you go.
So I just want to touch on a point, because again, Commissioner Smith brought this up. Joan talked about the issue of being data-driven, and as a state, we're really conscientious about being data-driven. And I wanted to remind you that last year, in 2019, the Economic Council started an initiative in the community that we named Together Martin. And that was long before COVID-19 crisis became an issue, and there were attempts to brand a recovery effort. But we held a community event at the end of February, the 25th and 26th. And we brought down a gentleman by the name of Quint Studer from Pensacola and his team to facilitate that for us. And it was literally days before the big announcement about COVID-19 and the beginning of a shutdown. So we've kind of put that initiative on hold. But as we've been going through this, and in my conversations with Commissioner Smith, as he mentioned, we're looking back at the outcomes of that workshop or that community kickoff event. And one of the recommendations was to conduct a study of the community. And this was before the issues of COVID, which are now layered on top of this, right? But we have a need to go out and gather data on the community's perception on a myriad of ideas. And I'm really happy to hear Rob Lord step up this morning when the issue was brought up and offer to help with this too. Because we're looking at, one of the things we talked about was how did different age groups in our community view issues in our community. And there's a myriad of issues that we're interested in, from education to businesses to the social activities in our community to healthcare, arts, community amenities, and all these other things that we really need to understand the community's perceptions on the level of service we have today and their interest and focus on those different areas going into the future. And now with COVID, an even greater need for some of that data. And so that was one of my requests again today, was to get your to gauge your willingness to engage with the Economic Council in our Together Martin initiative to conduct an in-depth study of our community. And we want to use a nationally recognized firm to come in and help us do that. We don't want to limit ourselves to a local organization, no offense to anybody, but we think at this level of detail and in-depth dive we want to take in our community, we'd like to reach out to a national entity and help us do that. So I wanted to ask you for that. We can come back with a detailed plan and a budget for that later, but I wanted to gauge your interest in that today. And then with that, I'll stop, because I've been up here a while. Sorry. But as I said, I wanted this communication. So.
Yeah, just to follow up on that last point with Ted, I think Joan didn't touch on it, spent a fair amount of time in this category. I think for our community as a whole, and I mean all sectors of our community, and I don't think there's anyone more important or less important than the other. Everybody has a piece in this, because this is not something that sort of took a segment of our community and said, okay, this is affecting this segment, but 3/4 of the rest of the community isn't. And when I say community, I mean whether it's local government, whether it's the healthcare industry, whether it's the nonprofit industry, the food industry, distribution, all of it was and has been affected. I think from our perspective as a county, I think that it is part of our role that we should be very well prepped and prepared to understand just how bad it has gotten and what is our plan moving forward. Do we have one? Do we know exactly over the next 6 months to a year to maybe even the next 5 years, what does that recovery strategy plan look like? And I think that, as we look at our budget this year with what we're doing internally as a county, is it reflective of that? Do we know, as we are parking dollars into programs, as we are doing policy direction on a much more global scale, not like what you just asked for relative to the school board, but are we making decisions based upon really the very baseline set of data that I can assure you, after listening to this guy from Pensacola, we don't know. And that's not really our fault, I wouldn't say, because we don't necessarily have to focus on the minutia at every single granular level of what's going on. But I think this has been widespread. I know this has been widespread enough that I think the long-term damage to our community and to the economic position of our community may be much more severe than we know. And so I think before we make any grand decisions on how do we get to a point where we start saying, okay, you guys, the wizards of our staff and all the amazing people we have working for us, go do this because we think this is the right thing to do. I'd rather have that baseline sort of understanding of these 6 areas popped up that we have absolutely no idea that was going on. This child care issue as a perfect for instance. I don't think a month ago even that someone was talking about how much impact will where our kids go for the summer, what they do after school or after school is over for the summer programs, how much impact will that directly have on our economic strategy climbing out of this thing? And is there a place or a role for us or not to be in the middle of that discussion? Again, by policy, is there something with our Parks Department that we should be actively doing differently than we would do under normal circumstances because of what's occurring? So I I think it's a great idea, Ted. I think it's something that we as a county should participate in, and I believe very strongly in that. I think for us to make really good, sound decisions, we need to have the background data that I don't believe that we have. Thank you.
I agree, bring it back with your proposal to a commission meeting.
And I think there are a number of collaborative agencies, like Commissioner Smith mentioned, healthcare, government, nonprofits, food industry, so.
Right.
Okay.
Yep.
Thank you for your update.
Well, great. And thank you so much for the conversation and the input and the dialogue and for your continued support of the business community. So thank you.
Thank you, Ted. Okay, we're approaching our 10:30 break, but there are some young ladies that have been waiting very patiently here. So I'm going to take one public comment, then we're going to do our 10:30 break. And so we have Frank Kalinowski. And I have some empathy that you ladies are spending your first morning of summer vacation with us, so thank you.
I promised them a special summer vacation,
Yes,
and here we are.
it's off to a great start, isn't
Really
it?
raised the bar. I can't get my own kids to come.
But I also got to tell you, that last, what is it, 2 hours, almost hour and a half, was the best performance I've ever seen with young ladies and their parents, so great job.
I'm very lucky. They are absolutely amazing. So,
What are their names?
This is Olivia and Catherine.
Good morning.
Thank you for
morning.
being here.
I'll first quickly, I'll try to get everybody on their break. I want to say thank you to everybody. I can't even imagine having to be in your position and making these decisions that you guys have to do, especially in the tough times that we're dealing with right now. So I appreciate your guys' service. Basically, you know, I'm here, and I kind of heard a few times today that the parks and baseball fields and things of that nature are open, or the motion to have them open. As of 8 o'clock last night, I can tell you that they're not open. We were cranking along in our baseball season for a few weeks, and then all of a sudden everything just shut down. I get that. You know, we were at a time we didn't know what we were dealing with. We had to do what we had to do to be able to keep everybody safe. We're now months later. Again, do we know everything? No. I mean, I've learned a lot today by listening. So I do understand we don't know everything, but I think there's a few things that we know, and I think children are on a huge risk, as I have heard. So I think it's really important that we get out there and we get the kids back on the baseball field. I mean, you know, get them out in the sun and soak up that vitamin D and you know, really build their immune systems again. You know, it's not doing them any good sitting in the house, you know. We've gotten the okay from the Little League organization that we're a go. So that's great. The hurdle is we want to have practices, we want to have games, and those locks are on that gate. I'm way too old to be climbing fences, okay? So, you know, I'm here today basically to ask you guys to please, you know, not in a week from now, not in a month from now, if we can act immediately and get the locks off the gates and let us go in there and have practices and play our games. You know, I'm a Martin County resident, I'm a business owner, but first and foremost, I'm a dad, you know. These guys are incredible kids, and they're amazing baseball players. We were off to a 4-0 run. We were doing great, and then it all shut down. So again, you know, I know you guys want to get to break, and I don't have much time, but I'm urging you guys, begging you guys to please get the locks off the gates, and let's be able to get these kids out there again. So thank you for your time. I appreciate it.
Thank you, Mr.
Don't go away.
Kalinowski. Commissioner Campy?
Oh, thank you.
Oh, he wasn't first.
We're going in alphabetical order. I thought we had given direction at our last meeting so that when the governor, because I had made a motion to open back up for youth or league sports, but Mr. Stoker's rightfully said with Ms. Woods that we didn't have direction from the governor at that point, but soon afterwards we did, and I thought we had left word that once the governor gave direction that you didn't have to wait till today to hear back. Now, I know we've had monsoon rainstorms, but as I spoke to the gentleman that just spoke just now, that wasn't the issue in Hope Sound on that particular field, or maybe they could have found a dry spot. I would make a motion that we ask staff, when possible, for the fields that are physically able to be open today.
Commissioner Smith?
I'll second that for discussion and comment from George, just because George stood up, so I'm assuming there's something you want to say.
I'm just standing here to answer any questions.
Okay. Can I ask, sir, can you come back up just for a sec? So given that you've been here for the last hour and a half,
Yeah.
where is it that you work, if that's okay for you to say?
I own a small business. I do a property maintenance company.
And the name of it?
5, the letter 5, the number 5, the letter K, 5K Property Maintenance. My last name is Kalinowski. There's myself, my wife, and I have another little girl as well. So that's the 5. And the K is the last name. I like to keep it all simple.
No, I guess really my purpose for asking you that is
Yeah.
because you came and took the time to come here and ask. And you are a dad, you're a business owner, I assume it's your business?
Yeah, I just had to text a client on the sneak and go, I'm so sorry, I'm running late right now. and I'm going to have a breakfast that I owe these girls right now. I guarantee on the way home it's going to cost me a fortune for breakfast. So.
But I just wanted to plug you for being here, doing that, asking, taking the time and caring enough to come out, so thank you.
Well, I really do appreciate it. And again, you guys are doing a great job, and thank you. I appreciate that. Is it okay if we might maybe sneak out now, too?
You may leave, yeah.
Well,
right.
we'll wait for the
Just do
motion.
what
We have a
George
motion
did and
on,
sneeze once and you got the perfect excuse.
Exactly. That's why I told the girls, I'm like, look, you have to start coughing. You know what? That's what we'll do. But again, thank you, everybody. I do appreciate
we
it.
want to wait for the
Yeah,
fruits
wait
of
for
your
the vote.
labor to be produced here.
So I can fit-
Motion by Commissioner Campy, and we have a second by Commissioner Smith. All in favor?
Aye.
Aye.
Opposed? Motion carries 4-0.
You guys are the best. Thank you very much.
Have a great summer vacation. Now we're going to take our 10:30 closed captioning break, and we will be back in 10 minutes. We are back from our closed captioning break for our special COVID meeting, and we left off during public comment. We have one more comment here, Angela Hoffman.
Hi, good morning. As you heard earlier from colleagues and friends in this room, childcare providers are essential services in order to rebound our local economy. In addition, the effects that COVID kids will endure for years to come is still unknown. We're all familiar with the summer slide, but the COVID slide associated with this pandemic is a deeply concerning mystery. Preliminary COVID slide estimates suggest that students will return this fall with roughly 70% of the learning gains in reading relative to a typical school year. However, in mathematics, students are likely to show much smaller learning gains, returning with less than 50%, and in some grades, returning nearly a full year behind of what we would observe in normal circumstances. Next week, the Boys and Girls Clubs of Martin County, like many other providers, will open their doors for summer camp at 1/3 capacity. Our certified teachers and mental health caseworkers who work with kids throughout the year and have proven track records of notable improvements in academic performance and test results stand ready to reduce this slide and to help the kids return to school next year ready for their best. I'd like to thank each of you for the motion you made earlier today, because as you now know, the limitations of the safety precautions due to reduced capacities makes the need for space outstanding. And the motion that you made earlier today, as a partner moving that concept forward, is so critical and so vital. So it is my hope that we can continue this conversation, that partners like Ted and Joan from the business community who understand how important this is to move forward to get people back to work, partners at United Way, and the other nonprofit partners, the YMCA that are providers, Parks and Rec, we all stand ready to serve our kids, and we appreciate your acknowledgement of that, both locally with the letter to the district and letter to the state legislature and to the governor's office. So thank you all very, very much, and we as the Boys and Girls Club stand ready to serve and hopefully meet the demand that's out there. Thank you.
Thank you, Angela. That's all the public comment I have in the room. George, you have some public comment for us?
Yes, good morning, Madam Chair. First public comment is from Michael Cloverfield. He writes, "Good morning. I hope this email finds you well. I am writing with concerns of people living under the bridge on the west side of Jensen Beach Causeway. We now have reached 6 vehicles, 2 F-150s, 3 conversions vans, and a Chevy sedan with Massachusetts plates. The population is growing on the west side of the causeway and it is becoming a health and safety issue for the public sharing the facilities with the homeless. The sheriff says there is nothing they can do, even though the sign clearly states no camping, to help this situation. Is there anything we can do to help these people? What is going to happen when the moorings are completed? Is this going to become another Shepherd's Park with people sleeping on benches? The people living in the Chevy are already sleeping on the ground next to their car. These messages are read and often no response, and then the email becomes inappropriate." The next comment is from Miss Debbie Greer. Ms. Greer writes, "In this state of emergency, families are asking for your help. Our economy is hurting, our residents are hurting, the children of our county are hurting. The people of Martin County want to get back to work. What is keeping them from getting back to work primarily is the lack of childcare and safe places for their children to go. It is vital to our local economy for children to have safe, healthy, and academically supporting summer camps while their parents are working. The cost of providing academically enriching childcare adherent to CDC guidelines is extraordinary. In fact, it is difficult to find venues large enough to serve the thousands of kids unserved, including those that were in Martin County School District extended day students. With extended day closed and reduced capabilities at other locations, there are thousands of young children with no place to go this summer. In our county, there are locations that are available within our school district's facilities that can provide the space needed to take care of kids safely this summer. Our school sites, I am asking that you, our county commission, support in resolution or by letter. the option for the school district of Martin County to open the facilities to partner child care providers. We need the schools to be open so that an organization such as Boys and Girls Club of Martin County can provide the necessary support for families. No one should have to choose between taking care of their kids and paying their bills. The opening of public school facilities is vital to get Martin County back to work, to get our economy on the path to rebound, and to give our children a safe, healthy, and supportive place to be. The next comment is provided by Donna Greer, and it says the exact same wording as the email I have just read to you. The next public comment is from Eileen Esselin. Well, okay. Her comment says, many didn't receive notices about severe flooding last Monday other than on the TV, nor on the tornado warnings with the current program with Alert Martin. Can instructions on how to correctly remedy this be sent out to the public or fix it so it will include all types of weather? We are familiar with the red code system, and that worked for everything. The next comment is from Audrey Kane, and she writes, rather than stating the number of cases contracted in the county in total, why not state the number of recoveries? Are we to assume that the number of daily people are still in the active state? How many have recovered? It only seems rational to report accurately instead of unintentionally contributing to the hysteria. The next comment is from Kelly Brill, and she writes, I am writing to comment on your decision to not allow Martin County summer camps to operate June 1st. This is absolutely ridiculous that you are not allowing local parents to make the decision on how to procure child care for their children. Several camps are able to safely operate. For example, Cowabunga Surf Camp, where my son was registered, has been more than responsible planning for safe care of our children. You are leaving parents who need to work in terrible situation 3 days before camp is to start. You need to allow parents to make their own decisions regarding summer child care and to allow our local businesses to operate. Stop overmanaging local operations. Allow the residents to make their own decisions. Also, I support reopening of Little League and summer sports. We need to get our kids outdoors and moving. They need to have an outlet. Sports and summer camps and working families need to have child care options this summer. And that, Madam Chair, is all the comments I received.
Mr. Merker is got Zoom going, so I don't know.
Okay, I neglected to mention that earlier. Now we have participation by the public on Zoom. And then how would one join that? Is the link on the agenda and the website?
Wait,
I don't have the mic.
Right there, on the right. The microphone's in the right.
I'm not touching that microphone. Thank you.
Well, your name is Mike, isn't that close enough?
Thank you, Commissioner. So we do have a link on the website, and I believe that we are also, Martha Ann or Laura can confirm that we are also putting a press release out that will inform the public of how they can participate, and with links to join the meeting and to also call in by voice telephone.
So do you have anybody on there now?
We, in fact, do, but I'm not confident that any of them want to speak, so we're going to ask them one at a time. We have 3 people. We're going to ask them one at a time if they'd like to speak.
Okay.
And I've never done this before, so let's see what happens. Don't look at me. Look at the screen. So let's see. Who's been waiting patiently? Melissa has been waiting patiently. I'm going to ask if you want to unmute. Melissa, do you want to speak? No. Okay. Next, Theo. Theo, I'm going to ask you if you want to unmute. Do you want to speak, Theo? If you want to, go ahead and unmute and feel free to speak. Let me see if I can get you up on the screen there. Hang on. Theo cannot hear you.
Has to unmute.
I think he... Try unmuting again. Hang on.
No, he's not muted.
Still nothing.
He's not, you're not muted.
Council right to hold it up. He's not speaking. Maybe he is.
He is unmuted.
Yeah, now he is.
I'm just not sure why we can't hear him.
Ooh,
Willy Wonka.
whatever you're doing.
So just so you know, we did test this. Pretty frustrating. Let me one more time, Theo. Let's see what happens.
Good morning. Can you hear me?
Yes.
Yes, we can.
It's like a space shot.
That's a yes?
Yes. Yes.
Thank you. Admittedly, I did not come to work this morning planning to be on this commission call. I believe you are talking about the summer camp decision. Is that correct?
Sir, this is public comment, so just like our normal public comment, you'll have 3 minutes to make your public comment.
Is this the issue of summer camps in Martin County?
We have discussed that this morning, so you could speak on anything you would like for 3 minutes.
Oh, thank you. Well, admittedly, I've had a hard time listening, and I'm not really sure what the actual status of the decision is. I received an email this morning at around 10:05 advising me that my children's summer camp scheduled for next Monday was being canceled because of a decision either recently made by the county or contemplating to be made by the county. So I don't know what the status is, but if the commission is considering not allowing summer camps beginning next week, notwithstanding the governor's decision to allow camps, I recently just sent an email to the commission, so I don't want to be repetitive, but I think that's a devastating decision, not just to our community, but to the parents and to, most importantly, to our children. I have 3 elementary age children, ages 5, 6, and 9, who live in downtown Stewart. They've been homeschooled for 2 months. They desperately want to interact and have social interaction with children their age. Admittedly, they're sick of us. They're sick of their family. They need social interaction. And if the county is safe enough to have bars open, restaurants open, beaches open, the beaches are just as crowded as any summer camp beach is going to be for surf camp or any other outdoor activities. I was riding my bike in downtown Stewart on Saturday night. Bars, they probably were 50% capacity, but they were all compressed in a 10-feet space. There was no social distancing going on in those environments that would be in a structured, supervised summer camp. I'm just asking you guys, if respectfully, commissioners, if you're considering not allowing the summer camps, I would ask you not to do it. Our kids in our community need you to, they need this interaction. And the parents that need to go back to work need these summer camps too. Thank you for your time and allowing me to speak, and, admittedly not expecting to. Thank you.
Thank you, sir. And just before we go to the next comment, Sarah, do you have a comment on?
Yes, Mr. Kipros, this is Sarah Woods. I'm the Martin County attorney. The county did not close summer camps, so I'm not exactly sure what camps you're referring to, but unless you're thinking of the school district. But
I don't know. I was just given an email, and it was told that this was the Zoom meeting, commission meeting that was going to be discussing it. I apologize if this is not the right forum, but that's what I was told. So I apologize if there's confusion.
if you would send us the email that you are talking about.
You did send an email to Commish?
Yeah, I see the email that you sent from Commish, but you're not explaining which summer camp your children attend.
I will forward that right now.
Thanks.
Thank you.
Thank you. Commissioner Smith, do you have a comment?
I do. Thanks, first of all, for getting on and sharing that with us. I think this is part of the challenge of how we communicate. There were a couple things said and a couple other things that were said that in other conversations. Again, from what Attorney Sarah Woods just shared with you, we, the county, have not closed any summer camp programs. The state, just last week, I guess, or the tail end of last week, allowed counties or communities to open up their summer camp programs. And so I guess we can't say that enough, that the confusion continues to spread. And thank you for sending us the email so we can communicate with whoever is putting that out there, because it is confusing. We also talked this morning about the school board had at least elected to at this point. We have requested from them this morning that they, with an official request that they asked for, to allow the school programs to be reopened and the school properties to be reopened. We won't know the answer of that yet until that's determined by them. And then you have all the nonprofits that are doing their activities and so on. So as much clarity as possible. And then I think also relative to the bars communication, bars are not still allowed to be open. There are restaurants that have bars in them, but to the best of my knowledge, the state has not released opening up quote-unquote bars. I do know that some establishments, I was in one the other night, that moved high tops to their bar, and they kept them 6 feet apart from each other, so it wasn't really that the bar was opening. They were using the bar space to sit people at the restaurant. But that, again, doesn't and has not yet been given to us by the state or is the purview of a county to regulate that. The other thing I was thinking as you were talking about that you live in the city of Stewart, I don't know what the city has done relative to their summer camp programs, but there may be a difference of how the city is dealing with its openings versus how we are. I assume, relatively speaking, they have kind of followed in step with what we're doing, but they may have put out some kind of communication that the city programs aren't open. I don't know. But that's also why it would be helpful to understand where the email came from so that we could put those fires out as they pop up like that. And again, thank you very much for being with us this morning.
Commissioner Campy.
Mr. Caprios, I just wanted to congratulate you on the historic, you are our first Martin County Zoom public comment in history. So congratulations. I think there's probably a prize van on its way to your home now.
Great.
And Ed's going to fund it.
Yes.
Do we have any additional public comment on Zoom?
We do have a few more. Well, at least we're going to find out if we have a few more. So next, Sarita, do you wish to speak? If so, I'm going to ask to unmute you right now. Yes, or would you like to speak, Sarita? Sarita Gregory. Going once. Twice. No. Okay, fair enough. And then Russell, I'm going to unmute you.
I have no comments. Thank you.
Thank you, sir. I believe that is everyone, Commissioner.
Wait,
That
do
is the list.
participants on the call, the Zoom call, have the ability to raise their hand or put a flag? Or?
They do, but we didn't publish that as a protocol. We will publish that as a future protocol, so we'll know who wants to speak and who doesn't.
Okay, with that, I think it ends public comment. One of our public... Sounds like we need to mute something.
No, I can't mute all.
One of our public commenters had a question regarding Alert Martin and its notification of the severe weather. And Chief Schobel, would you like to address that?
Absolutely. Thank you. I think this is an opportunity for education, and I certainly appreciate the confusion on the complainant's part. It definitely is confusing to me to look at this with, there's too many choices, it seems like. There's coastal flood advisory, coastal flood warning, coastal flood watch, or flash flood advisory, warning, or watch, and flood advisory, warning, or watch. So again, there's a lot of choices on there, and I think it's made for the user to actually filter through what exactly they would like to see. But at the same time, the average user, and I'm saying this, I'm picking on myself right now because I'm not really a techie. So if I want to be concerned about flood, I just want to pick flood and have those out there. So I think for everybody watching, make sure if you're concerned about flood, make sure you choose all of those boxes from the drop-down menu, and it will help with the advisory going out. It just so happened in this case that the person had picked a flood warning, but not a flood watch. And to me, I can see the average person out there, it's going to be synonymous. So does that help answer?
Do we have the ability to manipulate that app and maybe consolidate? Is that?
It was that, and is it ours to structure, or is that a pre-canned?
Those are great questions. I don't have the answer. So again, not a techie.
Go ahead, Commissioner Smith.
Just perhaps, Bill, what you might want to look into, if we have the ability to restructure that.
Right.
You might want to boil that down and make it much simpler for, like, check one box versus.
Agreed.
And if we could put something on our website under that alert, Martin, that maybe explains for an existing user how they would go in and adapt that or their settings, or just explain what they've selected.
Okay. Will
Right.
do. All right. Thank you.
Great, thank you.
Hey, it sounds like a great new job for our new PIO.
Okay, I think that completes our public comment portion. We're going to move on to Commissioner comment. Commissioner Hurd.
I'm set.
Okay, Commissioner Campy?
Yes, a couple of things. One, this new pandemic has created a new concern in our community in regards to the littering of personal protective equipment, or PPEs. I think many of us have seen on social media or actually witnessed it in person, where you're walking in a parking lot or somewhere out in public and you'll see a pair of rubber gloves or a surgical mask that's been thrown on the ground. I know that our friends at Keep Martin Beautiful, in collaboration with the Florida Department of Transportation, had enlisted a local firm, Firefly, to create a little public service announcement that they were nice enough to give to me. It's called Drive It Home, and I believe we're going to be able to play that now.
Martin County is beautiful, and during this global pandemic, when so many of us are sheltering at home, our waterways here and across the world are quickly healing. In our community, our coastal areas are looking clearer and more beautiful than they have in a long time. Sadly, there is another issue emerging as a result of COVID-19, and it's threatening our environment. Personal protection equipment, or PPE, is littering our community. Gloves, wipes, and masks, which are intended to keep us safe and healthy, are unfortunately ending up on ground, in parking lots, roadways, and other public spaces at an alarming rate. These items can find their way into storm drains and eventually into our waterways, threatening the health and safety of wildlife and marine life. But we all have a choice. We can dispose of these personal protection items properly. PPE, like any other item, should be thrown away in a trash receptacle. If one isn't available, just drive your PPE home where you can safely dispose it. This is one small thing we can do to help protect our environment. Martin County is beautiful. Let's keep it that way. A public service announcement provided by Florida Department of Transportation and Keep Martin Beautiful. Special thanks to the Martin County firefighters for production assistance.
Thank you very much. So I think that that's just a message that bears repeating, and hopefully I'm sure they have a social media campaign where we can share that. There's a lot of power in sharing those things. The second thing I had, Madam Chair, is I did receive a couple of emails from our swim teams that have been utilizing in the past Sailfish Splash, the competitive or the swimming side of our Sailfish Splash water park. And I know that several weeks ago we had reopened that lap pool for lap swimming, and I know it's been very popular. But I'd like to also ask, I know when we were talking about league sports and things like that, the swim teams that have been utilizing that very successfully in the past have not been able to come back. I know that in Palm Beach County, their swim teams are back in their community pools, and I would request, Ms. Krista, that as of today, we would allow those swim teams the opportunity to work with our Parks and Rec staff to come back to the lap pool.
Yeah, we need to, I know the lap pool became very popular, and so we'll just have to carve out some times that we can get those.
Right.
But I'll let Parks know.
Yeah, if they can just, I know that people swam laps coordinating with the teams in the
Yes.
past. So if we can go back to how it used to be done. And my final comment is, I very much appreciate what we heard from our Business Development Board this morning about creating an opportunity for people that are looking for employment, either to offer jobs, because there are still employers that are looking to employ people, and for our residents that are looking to find work, temporary work, new permanent work, whatever. There's a lot of pivoting that has to go on. I'd also like to suggest and recommend that people also look at Congressman Brian Mast's website. I know he's been really pushing hard to collaborate and become a clearinghouse of jobs that might be outside of the scope of, cut it, Ted, done? Outside of the scope of what the Business Development Board offers here locally. I would like to encourage people to go to Congressman Brian Mast's website for some other additional opportunities for employment. Ms. Chair, I've used up all my time. Thank you.
Thank you. Commissioner Smith?
Yeah, Taryn, in your updates, I think just because of some of our public comments this morning and what we've heard, I think the reoccurring theme of what we tend to hear from folks is that the confusion of what is, what isn't. I would encourage to keep doing that, keep tagging those items that that we're hearing from the public that they're not clearly getting. We had some communication, I believe yesterday, Sarah, if I recall, about community pools. We, Martin County, never closed community pools. If communities closed their pools, they chose to close them. I don't believe there was ever any mandate from the state to close community pools.
That's correct.
And so, some of the correspondence we've been getting are, please, Martin County, allow us to open our community pools again. We never closed them in the first place, but that's something that is becoming sort of a story out there. So again, I think every opportunity you have to reinforce, here's where we are, this is what we have done and what we haven't done and we never did do, I think would be helpful anyway for our public.
Absolutely.
That's it. Thanks.
Taryn?
Well, we were going back and forth with these emails with the gentleman that spoke, so we're trying to resolve that. It seems our Parks Department might have actually done something that we didn't realize they were doing, so we're trying to clarify that.
Sarah, any comments?
No, but thank you.
I forgot to do my own comments. I've been getting some emails from some folks that want to access or have memberships to the state park, particularly Jonathan Dickinson in Hope Sound, and they have a key password. I know that is certainly the state and not us. Do we have any information on if the state, apparently they have limited the amount of people in the park and the access for the code was suspended temporarily? I spoke with Representative Magar and Overdorf, but if we could just try to find out some information on when they might be opening that back up.
Okay, sure. And also, I was going to ask the board, I know Chair Jenkins isn't here, but since you're here today, we wanted to send a letter to the governor asking him for his assistance or support relative to Martin County or other counties that are not eligible for the CARES funding because of our size, that there be funds made available similarly, particularly if some of these entities aren't needing all their funds. We would certainly like to be able to help our businesses out by applying for those. So if that's okay.
Do we need a motion for that or just
I'd
direction?
move that we authorize staff to send a letter for that request on CARES funding for.
Thank you.
Motion by Commissioner Smith, and second by Commissioner Campy. All those in favor?
Aye.
All those opposed? Motion carries 4-0.
Madam Chair, Ms. Krista, can you explain that a little further? I think when we heard this morning about Palm Beach County put a $60 million fund together, I've had people reach out to me, small businesses here in Martin, wondering when we were going to do that. Can you explain the criteria that was necessary for those communities to reach that number?
Absolutely. So the CARES Act made payments directly to the state, their tribal governments and very large units of local governments that meet the eligibility requirements as a coronavirus relief fund. When they did that, only local governments with populations of 500,000 or greater were qualified to receive those funds directly. So we're asking our letter, essentially, I'm just looking at now, will be going up, that we'll have signed, will ask that, we tell them how big Martin County is, but we also want to see if there's monies that can be made available for the rest of the counties here in Florida. So that's kind of the extent.
Thank you.
Okay, and then one final comment on, that was a great video by Keep Barton Beautiful, and it makes me think we've been getting some emails from some residents concerned about the amount of trash being left at Stewart Beach. And the pictures are pretty disturbing. I don't know if the increase is because there are students that are virtual schooling or out of school, but I just wanted staff to bring that to the attention of the Sheriff's Department, maybe for some additional enforcement, because the amount of debris that, if they're taking those pictures daily, is pretty unacceptable. Commissioner Smith?
Just curious, is that on the beach or on access to the beach or everywhere?
From the email, it seemed like it was on the access or little areas that they're kind of collecting and hanging out and then leaving their debris behind.
Yeah, there's a dune. Apparently they, somebody put some large quantities of some seaweed and various things, and so they created this environment where they can't be seen by the guards, because we had this conversation yesterday with our lifeguards to figure out if there's a way that we can open that up so that they can be seen, because the kids can't be seen, so they're hanging out there and they're leaving trash and all that stuff.
Yeah, it's just, it is a constant problem. A few years back, we had an ongoing issue up at Jensen, at the north end of Jensen, just because it was not highly visible. And so I just, please, Taryn, whatever we've got to do to help that issue.
Yes, sir.
A few years back, we discussed, it got so bad with cigarette butts and other things that people were burying in the sand that we talked about, like mechanically raking at least the guarded beach area, because it's almost impossible to keep up with it. It would be interesting just to monitor that to see if that's something we need to be thinking about again. Thank you.
Thank you. Okay, I think that is going to complete our meeting for today. Our upcoming board meetings, our regular meetings are June 2nd and June 16th, and our special COVID-19 update meetings will be June 12th and 26th. And with that, we are adjourned.